Good very early morning, everyone. Monday morning. I'm sorry if the lighting isn't great. I have decided on the spur of the moment to make this video, and let me just get a drink. First cup of tea of the day. This is going to be a little bit of a difficult video for me because it concerns me, concerns Alfie, it concerns our family, and it concerns the nursing care that Alfie is having. On Friday, I went in to see Alfie on Friday morning and was told that, unofficially, I was told that Alfie had had a bad night, that a carer had to go into him. Now, bearing in mind that the one-to-one care at night has now been taken off Alfie. He was getting 24/7 care up until a couple of weeks ago, and then it was decided that the night care would be taken off. So he only gets one-to-one now from 8 o'clock in the morning until 10 o'clock at night, which is ridiculous because Parkinson's disease is unpredictable and it doesn't run to a timetable as we would do in a normal day. So I was told unofficially Alfie had had a bad night, and I said, well, what happened? Did he fall out of bed? There's a crash mat at the side of the bed. There's an alarm detecting movement. The person told me that they didn't know, but someone went in and stayed with Alfie for a little while, and I said, well, who stayed with him as the one-to-one's been taken off? I was told that the gentleman upstairs had died, his family were there, his one-to-one went in to sit with Alfie. That was Thursday night. I was told about it Friday morning. Alfie looked awful on Friday. He looked awful. He was lolling in the chair, drooling, t-shirt on, no cardigan on. His arms were cold. I said to the carer, why hasn't Alfie got a cardigan on? He wouldn't let us put it on. I said, well, put it round his shoulders, which I did. Gave him a wet shave, cleaned his face, which again had been neglected, hydrated him. Wasn't a good day. Whilst I was there, it wasn't good. Saturday morning, I go with my daughter and my grandson. Go to walk down to Alfie's room. Alfie was in the main lounge. His carer had gone on a break, so somebody else was sitting with him. He looked awful. No drink at his side, nothing. He was just sitting there. I said, why hasn't Alfie got a drink? My grandson went to get some milk. Alfie drank 2 mugs of milk straight away. He had 2 chocolate mousses. He had a cup of juice. He was thirsty. He was dehydrated. I went into his bedroom. His bedroom was a mess. All the pillows were higgledy-piggledy on the middle of the bed, as were Alfie's dolls. No top sheet under the weighted blanket. I stripped the bed, remade it, sorted the dolls out the side in the basket, made the bed nice for him, got the vacuum, got all the food up off the floor that was trodden, crisps, biscuits, pulled the chairs out. My granddaughter helped me. My son had come by that time. Pulled the chairs out and other bits and pieces. Got the cushions off the chair, crusts, days old, under the cushion. We cleaned that room thoroughly. Saturday morning, disinfected the surfaces, vacuumed. The only thing I didn't do was the bathroom, which the carer went to do. Sorry, the cleaner went to do. I then said, when I went in the room, sat there with Alfie, I took a bowl in, I washed him, I wet shaved him, massaged him. And because Alfie was not responsive, and he was in that sort of noisy environment, the telly was blaring, you couldn't hear yourself speak, I wanted him back in his room for lunch. So I had to ask who the carer was who was with him. She came with another carer. I had asked about the liquids before. Took Alfie into his room and I said to her, I've cleaned the room thoroughly. I said, but there was all bits on the floor, food, all everywhere. Could you not have just picked a few things up and thrown them in the bin? Empty water bottles that weren't Alfie's, they would have belonged to whoever, the carer in the room. Empty water bottles, empty soap dispensers. I said, couldn't you have thrown them away? It's not my job, it's the cleaner's job, not my job. Insolent. The look. I then said, this is the way Alfie's bed needs to be made, with a bottom sheet and a top sheet and the weighted blanket, with the dolls, the reborn dolls, put in the basket on the chest of drawers, except one that sits at the bottom of the bed. The bear can either go at the top of the bed with a leg behind or behind Alfie's chair, as long as it's not going to fall on him. She said, last time I sat with Alfie, you told me to make the bed a different way. I can vaguely remember the last time she was with Alf, and she'd left him at that time without a drink. And when I told her, she was insolent, and that was the word I used to my son then, and that was months ago. So she said, you told me a different way to make the bed. And then she turned and she spoke to my son, my grandson who was in the room, looked at either one from the other. She tells me one thing one day, then she tells me one thing the next day. Tomorrow she'll want the bed different again. This is the carer. I said, listen. I could not get a word in. So, I mean, I was becoming quite irate, and just a sort of, just went, can't get the word in. My son had to go out the room. He said, Mama, it was so funny when you did that bird impression. But it wasn't funny, really. It wasn't. Because this is serious. When a person is left without adequate water or liquids, when a person's room is that messy and dirty and untidy, that the carer's saying, I won't throw anything away, it's not my job. I won't pick anything up, it's not my job. What exactly is her job then? Job's worth. I said Alfie was dehydrated. She wouldn't look at me. She looked at my son. He was dehydrated. He drank 2 big mugs of milk. He had 2 mousses. He had half a cup of juice. And he'd got some more milk there. And then when my grandson was giving it to him. So I gave up then. And my grandson, I'm so proud of, he'll be 22 in February. And he doesn't normally say a thing. And he looked at the carer and he said, can you make sure that my grandfather is adequately hydrated, that it's a basic human right? She started having a go at my grandson. Don't you tell me my job. We left it at that. I gave her, or put to one side, I said, this is a list that I wrote out, which started out from me. Thank you so much for caring for Alfie. Could you? And then I listed how to do his bed with a bottom and a top sheet, etc. Only a few little things. She wouldn't look at it. So we left, and I left feeling pretty awful on Saturday. Haven't seen my husband in that state for a long time. I sent a text to my son, my youngest son, who goes on Sunday, and told him what had happened. And I rang the home on the evening to make sure that Alfie was okay, that he was going to have some cereal before he retired for the night. And the nurse started getting antsy with me on the phone, saying, why didn't you come and see me, blah, blah, blah. And, it's every time when I've got a problem, or there is a problem with a carer, she really can't. This nurse has said, I can't take it. I can't cope with all the problems here. How does she think I feel? How does she think other people feel? I see it more than most people because I'm there every day. And the last month, the care has taken a zoom downwards. So she said, your son contacted me. She said, and she said, it always seems to be when you're on shift. I don't know what my son said to her. I spoke to him briefly yesterday, and he said he did tell her what had been going on, blah, blah, blah. And when he went to visit his dad yesterday, Alfie was in bed, but he was okay. And the nurse went into my son and said, I've handed in my resignation. Well, if she has, that's nothing to do with us, because she said she was going to do that when she learnt that the manager was going, who left on Friday. And she said she was thinking of doing it, so maybe, that's the reason, I don't know. But if the fact that we are voicing concerns, what I'm trying to say is, if she's trying to say she's resigning because of what went on at the weekend, if the fact of voicing concerns over the lack of adequate care, as my grandson said, it's a basic human right to have fluids. if people are going to resign from their position rather than stay in situ and address the issues with staff who really are not adequately trained, or they don't really care, then maybe that person shouldn't be in a caring profession at all. I'm not naming the home, I'm not naming names. I'm saying the situation as it was at the weekend. I think there's been about 4 occasions when Alfie has been quite severely dehydrated, and on each occasion I picked it up. There have been occasions when they were zapping him with lorazepam at night because of his wakefulness, to the point where his blood pressure was dangerously low and he was hospitalised. It seems to be heading in that direction, and I'm not going to allow it to happen. I need support. I need support from family and friends who are around about me. I need support from friends on Facebook and YouTube. I am going to begin a blog. It is going to be a blog where no punches are pulled. It needs to be. One of the main causes of death in nursing homes is dehydration. A resident in a nursing home is 5 times more likely to be admitted to hospital dehydrated than somebody admitted from their own homes. Talking about elderly people now. Alfie can't ask for a drink. He can't verbalise. He can't say, I'm thirsty. Other people there can't say, I'm thirsty. Certainly when the cup is put to his lips, he'll drink it. When on a good day, he can reach for the cup and drink it. At all times, there should be a drink to hand. At all times. At all times, his room should be clean. Even prior to the cleaner going round, if there are empty bottles, throw them away. If there are dirty tables that he uses, wipe them over. Never mind what your job is, you're there to work, you know, and what needs to be done needs to be done. I don't get paid to hoover, to scrub tables, to throw rubbish away, but I did it. I don't get paid to wash and shave my husband every day, make sure he's hydrated, advocate to the point where this advocating for him becomes complaining and pushing to get things right. All I want is for Alfie and other people in similar condition, suffering from that terrible illness or other illnesses, to be cared for properly, for them to be treated with respect. Not for when there was a man taking his clothes off the other week, dementia, and one of the carers shouted at him, and she shouted, "Oh, Jesus Christ." She saw me looking at her. I need your help. I need support if I'm going to be doing this blog. It's not going to be confined to what's going on with my husband. It's going to involve some research into what's going on in the nursing homes, into what's going on with agency staff, into what's going on with the cost cutting. Dehydration can lead, and does lead, to kidney failure, coma and death. It's not happening to my husband. And I'm not going to, if I can help it, allow it to happen to anybody else there either. I'll be back later. Bye-bye.